But first, transition for care for your loved one. And joining us is Mr. Paul Smith, who is the manager of Care Transitions. And wonderful program here, because I love the fact that you kind of talk with some of the patients that are leaving the hospital and just more or less checking up on them and saying, hey, are we making sure everything is doing what you're supposed to be doing? And as we're talking here in the break room, that I remember when my daughter was born and the nurse was saying, all right, here's your discharge papers, here's all these rules and things that you have to do. And I had to say, all right, stop, let me record all this because I'm not going to remember that. And that could be difficult, but that's where you guys step in. So tell us a bit about Care Transitions.
Well, what Care Transition is we actually help patients who are discharged from the hospital who have certain diagnoses like congestive heart failure, heart attacks, pneumonia, acute kidney injury, strokes, and COPD. And what we do is we follow those patients for 30 days after discharge to make sure that everything we promise them in the hospital are followed through, whether they're supposed to get home health, make sure they got their medicines, make sure that they know how to take them, make sure that they truly understand their disease. And so we kind of help that patient become independent with their disability.
Okay. Now, when it comes to taking care of your loved ones, the family support is tremendous, but this is also peace of mind for the family, too. And how does that help them?
Well, when they are in the hospital, we actually educate the patient and the family about the diagnosis that they have to make sure that they truly understand it and make sure that if they have any questions, whether it's like, how much fluids can I drink, or what kind of foods can I eat with this diagnosis? We help them with that so that they have a better understanding and they're more relaxed when they take them home, that they can truly help take care of them at home.
Now, the overall goal of this and following them for that 30 days, what is that main goal?
The main goal is to help the patient feel comfortable taking care of themselves with this diagnosis or family, to make sure that they truly understand it, but also to make sure that for those 30 days that they have that opportunity to contact us if needed, and because we contact them once a week, to make sure that they're doing well and that they don't have any questions or any concerns, and making sure that they get to their doctor's appointments and and that they truly understand what went on at the doctor's appointments, because we talk to them and say, what did the doctor say, and then we help them better understand this is what they meant, so that they truly have a full understanding of taking care of themselves.
Now, how do we become a part of this program? I know we may have folks that are maybe even watching from the hospital here during lunchtime, or maybe there's a loved one that knows that they have to take care of someone. How do they contact you? How do they become part of this program?
Well, what happens is anytime someone comes in with those diagnoses I mentioned earlier, I automatically am flagged and I go and see those patients and their family members to help them better understand what I do, what's expected, and to see if they have any questions and if they want to be a part of the program, because it's not something they have to be a part of.
And of course, the overall goal too, we don't want patients to go back to the hospital.
Exactly.
Obviously, they don't want to either, but there's those little small steps, or maybe something that they just forgot about or didn't realize, and that's where you guys really do come in and help out.
Exactly.
All right, well, we're going to put up the information here, because if you are interested in service like this, or maybe you see Mr. Paul that stops by and chats with your loved one as well, he's here to help out. Of course, part of Erlanger and all the great things that they do, the best way to just get information is to go to their website, erlanger.org, or you can call the phone number 778 link, that is 778-5465, and ask about Care Transitions. Ask about Mr. Paul Smith, who's the manager there, and about how this service can certainly benefit your loved one, or maybe possibly even benefit yourself. Paul, we appreciate you coming in.
Thank you very much.
And I appreciate what you do as well.
Thank
you. Those
you.
little things that matter the most.
Exactly.
All right, folks, we're going to switch gears and say a big